Hello, today I'm doing a head-to-toe assessment video. This is my volunteer. Can you tell me your name?
John.
Can you tell me your last name?
When?
And your date of birth?
March 30, 1984.
Do you know who the president is currently?
Donald Trump, yes.
Okay. So I'm just doing a quick review to see if you're able to recall anything. And while doing that, of course, I'm doing a quick assessment head to toe to look at if he have any kind of smell or odor, anything that visually jump out. And then after that, I would like to inspect his head, basically the face and the hair. His face is symmetrical. The hair is evenly distributed, and I'm looking for any kind of lesions, any infestations, any open areas, which I do not see anything. And then I'm going to palpate the scab. Tell me if you feel any pain. Any pain?
No.
Okay. So there is no pain to the head. The hair is evenly distributed. There's no infestation, no abnormalities noted. And then after that, I want to look for any facial drooping, which is symmetrical, no droopy noted. I'm looking for any kind of lesions, any abnormal, any pain. I do not see any lesions or anything. I am testing for the cranial nerve number 7. So can you close your eyes real tightly for me? Tight, tight. Open. Puff out your cheeks. Frown. Okay. He's able to do that equally, bilaterally. And do it with ease without any problem. So now I'm going to palpate for any kind of masses or indentations and any skin breakdown. So, and then I'm also going to palpate the ear and inspect at the same time to see if there's any kind of lesion. You feel any pain?
No.
Okay. There's no pain noted. I am going to palpate the temporal artery. Okay. And both are filled with 2+ bilaterally. I am going to test the cranial nerve number 5, which is the trigeminal nerve. And this nerve is responsible for basically chewing. Alright, so I'm going to try to push your jaw up while you open your mouth. So, okay. Alright, he can do that with ease, no problem. Any pain? Anything? No. Alright. And I'm going to test for the TMJ. So, blend your jaw real tightly for me. Okay, open. Close it. I don't hear any clicking sounds, any locking of the jaw. Alrighty. And then I'm going to move on to palpate the frontal and the sinus. Tell me, you feel any pain?
No.
How about here?
No.
I do not feel any kind of swelling. He denies any pain or tenderness in that area. Now I'm going to inspect the nose. The mucosa is pink and moist. I don't see any locket. No nasal polyps noted. I'm gonna close one nostril. Can you breathe out for me? Okay. How about this one? All right. He's able to breathe in and out both noses without any problems or issues. I'm gonna check your eyes. So both of the eyelids are nice and pink and moist. Both sclera are white. No jaundice noted. No redness. Look that front. I'm going to shine the light. Both pupils are equal and restricted to light, and it moved from 4 millimeters to 2 millimeters. All right. So now what we're going to do, we're going to do the visual field test to test the cranial nerve number 3. So I'll have you follow this pen light for me. Just keep your face straight and then follow my pen light, okay? With your eyes. Very good. So their eyes is moving. I don't see any kind of movement with the eyes, any nystagmus with the area. Next, I will be testing the cranial nerve number 8, which I will whisper a word. So I'm going to whisper a word. I'll have one of your ear closed, whisper a word, and then you tell me what it is, what I said.
Monday. Apple.
Okay. So both ears he can hear out of. There's no problem with cranial nerve number 8. Next, I'm inspect the tympanic membrane. So I want to use this device and pretend it's an otoscope. So I'm pulling the pinna up and out and looking both ears. All right. Both supposed to be shiny and pearly. I don't see any kind of redness. Do you have any pain in your ear?
No.
Okay. All right. And then next, I will test the cranial nerve number 1. So have your eyes closed for me. Can you tell me what that smell is?
Lemon.
Yep, it is the lemon. So very good. And then I will be, from this point, just checking his lips. The lips are pink and moist. I don't see any cracking, any lesions, any swelling. Let's see. Can you open your mouth for me? Stick your tongue up. Okay. Very good. Stick your tongue out. Say ah. There is no lesions, no open areas, no swelling. The uvula is moving upward like it's supposed to. I don't see any abnormalities. The tongues are moist. So the cranial nerve number 7 is intact. And let me check. Now I'm going on to check the trachea. Swallow for me. Very good. The trachea is midline. I am going on to check the cranial nerve, number 11, which is the accessory nerve. Can you move your head from side to side for me? Very good. Back, forward. Turn your head to the side. Turn to this side. Very good. Any pain?
No.
Okay. So the cranial nerve number 11 is intact. He can do it with ease. There's no pain. All right. I'm going to push down on your shoulder, and you're trying to push up for me, okay? Very good. I'm just testing the strength of the shoulder, and he able to do it with ease. All right. So I'll move on to checking the lymph node to see if there's any pain or tenderness. So while I'm checking for any swelling, any area, any hardness, I want you to tell me if you have any kind of pain, okay? I'm checking the pre-auricular,
No pain.
post-auricular,
No pain.
parotid,
No.
occipital,
No pain.
superficial, cervical,
No pain.
submandibular,
No pain.
submental,
No pain.
supraclavicular.
No pain.
I don't feel any kind of swelling, or there's no lymph node that are able to be palpated. The trachea is midline. And I'm going on to check the thyroid gland. So, can you turn your head one side and swallow? Okay. Same way. Turn your head to this side and swallow. Okay. I cannot feel any thyroid gland that are swollen. There's no pain. Okay. Now I'm going to auscultate for any thrill or bruit with the bell of my stethoscope. So, turn your head. Okay. There's no bruit noted. Now I'm going to inspect his arm for any kind of abnormality, any lesions. I don't see any area, no swelling, no rash noted, no lesions on their skin. So now I want to have you open your arms to the side, moving up. Okay, put it back down. Cross one arm over. Okay, cross the other arm over. Very good. Now I'm going to palpate. Do you have any pain?
No.
Okay. Okay. Both joints are able to move. There's no pain, and it's in place. I'm palpating this. I'm inspecting and palpating the skin. It's warm and dry to touch. There's no moisture. Now I'm checking for the wrist. So hold out your hand for me. Okay, moving up, down, side, side. Okay, very good. Now hold your hands like this and then push against me. Good. Now pull. Good. The strength are equal on both sides. There's no weakness. Okay, hold my hand. Grip my hand tightly. Very good. The grip are both equal bilaterally. no weakness on either side noted. I'm gonna palpate your radial artery. Okay. Both radial arteries are 2+. All right, close your eyes for me and sit straight up. Hold your arms out. I'm also testing for the Romberg test. Very good. So there's no drifting noted. Both sides are able to be extended bilaterally. All right. So will you take off your shirt for me? So what I'm doing right now, I'm just inspecting the chest to see if there's any kind of lesions, any abnormalities, which there is none. And I'm checking the AP chest to make sure that there are no barrel chest, which he's not. Are you a smoker?
No.
No. I don't hear any kind of heavy breathing at all. So, all right. So now I am going to listen to the lung sounds, anterior. Take a deep breath in. Out. Deep breath. So there's no abnormal adventitious sound noted anterior. I will listen to the back side. Take a deep breath in. Very good. There's also no adventitious sound anterior or posterior. So I'm going to go ahead and listen to the heart sound. Listening to the aortic. Pulmonic. Herb's point. Tricuspid. And mitral. I will listen to the apical pulse. Normal, S1, S2 noted. I don't hear any heart murmur or any abnormalities. So I'm going to check for tactile fremitus. Can you say 99?
99.
99?
99. 99.
Okay. Turn to the back for me. Say 99.
99, 99, 99.
So the tactile fermenters are felt on bilaterally both sides. There's no uneven. And I am going to percuss. So can you lay down for me? So resonant are heard bilaterally, which is normal. So I'm going to inspect now the abdomen. So I don't see any kind of hernia, any aortic aneurysm. Nothing is protruding noted. The skin is warm and dry. Now I'm going to auscultate all 4 quadrants, starting with the upper right quadrant. The lower right quadrant. The left lower quadrant. And the left upper quadrant. Okay. So bowel sounds are heard on all 4 quadrants equally. Do you have any abdominal pain?
No.
Okay. Do you have any problem going to the bathroom or
No.
urinating?
No.
Okay. Alrighty. So he denies any pain, any kind of abnormality with the bowel movement. Alrighty. So I am going to auscultate also for Rui with the bell of my stethoscope. Checking for the renal artery. And the iliac arteries. And since I do not see any hernia or aneurysm, I will start with the light palpation. Do you have any pain?
No.
I'll start with deep palpation. Let me know if you have any pain.
No. 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 No pain.
Okay. So there's no pain throughout all 4 quadrants. Now I'm moving on to the lower extremities, which I'm looking at the skin. The hair are evenly distributed. The skin is warm and dry to touch. There's no abnormal growth or lesions noted. I don't see any swelling or edema to the bilateral legs. Okay. I'm going to palpate the popliteal pulse. It's 2+. 2+. Dorsalis pedis. Posterior tibia. They're both 2+. I'm feeling the pedal pulses. And it's 2+, equal bilaterally. Now I'm checking for the muscle strength. So let's see. Move your leg up and out. Any pain?
No.
Okay. Move this leg up and out. Any pain?
No.
Okay. So you have good range of motion to the bilateral lower extremities with no pain. All right. I will alrighty. Checking the Babinski reflex, which is negative. Alright, you can sit back up for me. Very good. Alrighty. So what we're gonna do? Alright, I'm gonna push against you, and you're gonna try to push your leg against me. Okay, push. Very good. Now I'm gonna pull, and you try to pull back. Very good. Alright. So turn your feet up, down, side, side. Okay. He also had very good range of motion to bilateral legs. Able to move both sides with strong movement, good range of motions, no pain noted. Alrighty, so can you stand up for me? And come over here. Alright, so stand right here and walk straight forward. Very good. Stop. Turn around and go tiptoe. Tiptoe. Okay. Alright, and then can you do the heel to toe? Very good. And then you can come back here. So he's able to perform all the tests. His gait is strong and steady. I did not see any kind of swaying. So can you stand up for me? Okay, hold your arms out. Close your eyes. Again, we're testing for the rhomboid. Very good. I don't see any drifting. All right, can you bend forward for me? As far as you can. Very good. You stand up. Bend backward. All right. Turn to one side. Turn your body. Okay. Now turn to this side. Very good. You also have very good range of motion with the spine and back. Do you have any pain when you do that?
No.
No pain. All righty. Thank you very much. That concluded our head to toe test.